Hello, everyone. This is Tom Fox back for another episode of Diabetes, the Metabolic Bully, joined again by Dr. Byron Black. Dr. Black, first of all, welcome back.
Thank you. Glad to be here.
So we've had several episodes where we took up a fairly specific topic, and I thought maybe for this one and the next one, we might step back and have a little more general discussion on some of the issues that you and your team deal with, you and your team at the Medical Fitness Clinic of Kerrville deal with on a day-to-day basis. So I thought we might start with, could you explain what clinical exercise physiology is and how does that relate to either preventing or helping to treat diabetes?
Good question. A clinical exercise physiologist is really in the training. Like I have a master's in exercise physiology, and I have 600 clinical hours working in the different metabolic fields. And what clinical exercise physiologist does is it works with people that have the comorbidities that are a little bit higher risk, that need a little bit more attention to detail. So that's what we provide there is we provide the oversight and supervision during the exercise sessions. So when you're in there with us, we are right there beside you the entire time, making sure you're doing things correctly.
In an earlier episode, you talked to us about how, I don't want to say you stumbled into this field, but you became aware of it and started to study. But the question I really wanted to ask you is, you're very passionate about this.
Correct.
And why the passion to bring exercise as a treatment or even a prevention of diabetes?
I think in one of our other episodes, I talked about meeting my first diabetic in 2004. In my having to study up on diabetes to work with her, the more I studied it, the more I saw that exercise was absolutely, you couldn't get away from exercise if you wanted to control the blood sugar. And that, being an exercise physiologist, as I kept studying that more and more, I realized that without exercise, diabetes is going to run rapid. And so that's my goal, is to get exercise out there as the controlling factor for diabetes.
I don't want to sound too naive, but there's not a lot of negative benefits from exercise.
None, not at all.
And for over 30% of our county is over age 65. Is that hold true for the mature population we have in Kerr County?
As far as
exercise and not being negative and something that you should do.
You should do, yes. I don't care how old you are, you should be exercising.
And then in addition to your passion, you actually specialize in it. I talk to a lot of innovators in the entrepreneur field, and there are those who see a need, a business need. There are those who see a business opening. There are those who have an aha moment. And did you see a business opportunity? Did you see a need, or did you just have this passion to bring something as basic as we've been doing since humans came on this earth in the form of exercise?
I think it was a little bit of all three of those. As I said, when I first met that first diabetic, I saw the need for bringing exercise into the diabetes field as a way to control blood sugar. And then as I started looking around and as I got more education and more certification and more knowledge, I realized there's just not a lot of people that work in this field in the way that I'm working in it. You have your dietitians and your nurses and your doctors, but there's really not a lot of well-trained people to work specifically with diabetics.
I'm going to talk about personal experience because I think when I was 15, they said, you're borderline, you're pre-diabetic. And I was counseled on diet. And at age 65, I got the same diagnosis, and that was counseled on diet. And literally every other doctor appointment in between. And not once did they talk about exercise. Could I first ask you, why is that?
The dietitians don't get paid to talk to you about exercise, and the providers don't get paid to talk to you about exercise programs. They may tell you need to exercise, but they're not going to build an exercise program for you. And the knowledge that is and education that is needed to work with diabetics, goes way beyond just saying, Tom, you need to go work out. You've really got to have somebody that knows the ins and outs of diabetes, the medications, and how all of that works together.
Let me use that to lead into what are some of the physiological mechanisms behind exercise, either preventing or helping diabetic condition?
Wow, it's going to go deep. So when you exercise, you're contracting your muscle cells, okay? And when you contract muscle cells, you use glycogen or glucose. And so when you exercise and you deplete some of those resources in your muscle cells, your body will replenish those when you eat your next meal. Okay, and that's what exercise does, is it keeps a turnover. You deplete your storage, and then your body takes what you eat and puts it back in there for the next time you exercise. And so that's really the nuts and bolts of it, is you got to use it and then replenish it.
Are there some specific exercises that you recommend? Is it to the individual patient? How do you assess that?
Every diabetic should be involved in a good cardio program. And a good cardio program for diabetics is between 5 to 6 days a week of walking, running, biking, elliptical, swimming. And they should be involved in a good strength training, weight training program. Those two work together to keep the muscle cell efficient and working properly.
When you say cardio, does that mean getting your heart rate up to a certain level, or is it something different?
It's good if you can get into a certain heart rate range, but if you're not able to walk very fast or very far, then the best thing you can do is start where you're at and do what you can do. I don't care if you have to do 2 laps around your couch. That's a good starting point, and you keep building from there.
For instance, my hamstrings are torn up, so I can't walk very fast.
Right.
I can walk about 3 miles, but I can get on a bike and get my heart rate up.
Perfect.
Is getting on the bike and getting my heart rate up better for what you're prescribing, or is it just moving like I would walking?
Walking, any equipment that you use that you can do for an extended period of time and get your heart rate up is good equipment. So you can't walk because of the hamstrings, but you can ride a bike. Perfect. No fault in that.
So what about weight training? Many people think weight training means you're trying to bulk up. I don't think that's what you're saying.
No.
Then explain what you do mean by weight training.
A lot of people think you have to spend hours in the gym and look like Ronnie Coleman or Arnold Schwarzenegger. And that's the furthest from the truth that you can get. A good weight training program is 2 to 3 days a week, 2 to 3 sets per exercise, and 12 to 15 reps per exercise, per set. And one of the key things that a lot of people miss out on when it comes to weight training is going to muscular failure. They tend to go toward a number versus finding that muscular failure. And that's the muscular failure is where all the good stuff happens. But you don't have to spend hours in the gym.
I think one of the things many people struggle with is consistency and motivation. I've been working out since I was about 11, so it's just part of my life.
Right.
And it's a routine to me. And if I don't, I get a little twitchy. So that's not a problem for me. But how do you help people who haven't perhaps worked out as much as me, get them started, but more importantly, keep them going on a regime?
As a while ago, I said, you start where you're at. A lot of people, most people that don't have a workout routine, they can get benefit from just twice a week. Now that benefit's going to be short-lived, and eventually they're going to have to go up to 3 times a week. And so that's the key part of it, is listening to your body. And when it says you're done too much, you back off. And when you don't feel like you're doing enough, you increase. But you do it in small chunks of increases. So that way the body has a chance to adapt to the new stimulus. If you try to go from 0 to 100, you're only going to get to about 70 before your body says, that's it, no more. We got to take a break. But if you do it in small chunks, it just adapts right along with you.
Let Let me take a little bit of a deep dive into a technical area, and that's insulin and insulin sensitivity. What can be, or what are some of the things that you need to consider around exercise and how they impact insulin sensitivity and blood sugar regulation?
The first thing you have to be aware of is the medications that you're taking and when you take them, because you don't want to take them, say for insulin, for instance, you wouldn't want to take your insulin and then go to the gym and work out, because now you're going to get a double whammy on your blood sugar and you could go hypoglycemic. So you want to make sure you're taking those spread out. And exercise, the way it works is your cardio. When you do your cardio, it's like the vacuum cleaner of the cell, for the cell. It takes all the junk, all the metabolic waste out of the cell. And then your strength training or weight training helps build up the efficiency of the cell. We have a little vesicle, little part of our muscle cell called the mitochondria. And what strength training does is it makes that very efficient. And when you strength train, you not only have that mitochondria, but your body will make another one and another one. And so that way you're burning more calories every time you exercise.
Let me turn to diet, and specifically diet and exercise. What advice do you have for either combining those two, or at least thinking about how you can use both of those strategies to help prevent or manage diabetes?
When it comes to, I prefer to use nutrition, because diet has such a negative connotation to it nowadays. Everybody thinks that you're going to go on a diet, so you got to give up all this food. But if you say good nutrition, now you get to eat pretty much what you want. And when it comes to good nutrition, there's two parts to it. It's not cutting out all this stuff from your diet. It's adding stuff into it. It's adding the fruits and the vegetables, the whole grains, and making sure that you're eating as healthy as possible. Doesn't mean you can no longer have a Snickers once a week. It just means you're trying to eat better. And then there's also eating habits. Do you eat breakfast in the morning? Do you eat lunch? Do you eat dinner? Do you do the snacks in between? Some people tend to say that's old school thinking, but it's still around today, and it's still very effective at helping you to maintain a good eating habit. Because if you skip breakfast and lunch, chances are you're really going to binge at supper. Whereas if you do those small meals, you're not as hungry, and your body learns that you're going to feed it. So instead of storing everything you eat, it uses it for energy.
Well, Dr. Black, unfortunately, we are near the end of our time for this episode. But before we leave, I wanted to ask you if our listeners wanted any more information on the topics we've touched on, or the Medical Fitness Clinic of Kerrville, what would be the best place for them to go?
They can come by and see me at Peak Fitness at 1337 Bandera Highway. They can call or text me at 210-569-4129, or they can send me an email at byron@mfcok.com.
And your business website?
www.mfcok.com.
Well, Dr. Black, thank you very much. I look forward to continuing this conversation.
Thank you.
This is Tom Fox again. Thank you so much for listening to this episode of Diabetes, the Metabolic Bully. I hope you will enjoy this podcast, and that if you do, you will subscribe, rate, and review wherever great podcasts are listened to. Diabetes, the Metabolic Bully is a production of the Texas Hill Country Podcast Network.